Are you looking to take your TCM practice and truly bridge it into traditional Japanese medicine? You're in luck. Today, I'm going to cover the 5 top things that I see practitioners needing to do to truly transition their practice and to get better results in their clinic. Are you curious on how traditional Japanese medicine can transform your practice? Let's chat. There's a link to that discussion in the description box below. Let's talk about how traditional Japanese medicine can truly transform your results and your confidence. Now, here at ShinKyu University, I teach practitioners from all around the world. Literally, we have members from India to England, France, Belgium, Chile, Brazil, you name it, we have it. And something that I found as a common factor to every single one of my practitioners before coming into ShinKyu University is they lack 5 basic things in their practice. Now, this isn't because of lack of effort or lack of trying. It's simply that, unfortunately, these things aren't taught in acupuncture schools to a high degree, and the lack of mentorship in our field really does, unfortunately, lead to a very low amount of confidence in many, many practitioners. Now, the very first thing that I like my practitioners to do is really know what they're treating, why they're treating it, and understand the results that they're getting. Now, I hear this a ton from people that I talk to, again, all around the world. They say, I don't understand that I try this technique, whether it's Dr. Tan style or Kiko style or meridian therapy or whatever it is they're using. They use it on one client, they get amazing results. They use it on another client who's almost basically the same, and they don't get good results at all. And they don't understand the difference. Now, meaning that why is it working for one person and not working for another? What did they do wrong? What should they be doing differently? Now, again, this is from no fault of the practitioner. So if you have had that experience, don't worry. It's 100% normal. You are not a unique snowflake. In fact, everybody is having that unfortunate experience. What is happening here is that the pulse diagnosis for most people, granted, some people, their pulse is just phenomenal, but for pulse diagnosis for most people, and also the palpation diagnosis for most people, is just not at the level that it needs to be to truly find what's happening in the patient's body, and then the technique to answer that is also lacking. So let's first talk about diagnosis. That's the number one thing, and how you can change this and how traditional Japanese medicine can really, really help you. So with pulse, one of the things, and I have a whole video on positioning of the pulse and things like that, one of the things that I found through teaching hundreds of people and talking to people from all around the world is that pulse diagnosis is not taught in a very systematic way, meaning that every time that you take the pulse, for most practitioners, I don't want to say for everyone, but for most practitioners, your fingers are in different places and the pressure that you use on your fingers is different. And honestly, the level at which you're looking can sometimes be different too. And because of that, it's going to really skew your results. So if you're really interested in doing just one thing for your practice, I would say, honestly, study the pulse. It is really difficult, but if you're looking for just some really simple information, meaning, right, fast or slow, is it floating or deep, right? Is it big or small, right? If you can have these 6 components, and you can understand these 6 components of the pulse, you're going to be amazing at diagnosis. It can really just take your treatment to this next level. So to give you a hint, and this is from one of my teachers, Ora Sensei, he did a whole lecture on this that I have on ShinKyu. It's one of the lectures that he gives to the students of Toyo ShinKyu, the school I graduated from in Japan, is that if the pulse is fast, right, that means heat. Really easy, right? It's fast, it's heat. If the pulse is slow, it's cold or deficiency, right? And fast can also mean excess. If it's floating, the pathogen, or jaki, are symptom, usually on the surface of the body. And if the pulse is deep, well, usually it's internally in the body. And if the pulse is really big, right, that's a lot of yang energy. We have a lot of heat oftentimes. If it's small, the opposite. So if you just want to go through and just honestly applying really basic logic, just really basic stuff to it, the pulse can be not that difficult. Now, when you start talking about water dripping on the side of a bamboo in a monsoon, I don't know, like something really, really complicated, yes, it's going to be super confusing. But I would say for the bulk of practitioners in the bulk of traditional Japanese medicine styles, you don't need to have that complex of a pulse diagnosis to really get at what you need to. Now, the reason for that is because in traditional Japanese medicine, almost all styles, after taking the pulse and looking at the tongue, we're also palpating and doing what we call a hara diagnosis or an abdominal diagnosis. Now, I have tons of videos on hara diagnosis. If you're interested in figuring out kind of like what it is and what it looks like, I kind of show the basic Iyashi no Michi hara diagnosis because every style has their own style. So you can definitely check those out. But saying that, based on the pulse, you can go, great, I think that there is heat and an external pathogen in the upper taiyang or in the lung meridian, depending on how you look at the pulse. And then you can look at the tongue and go, oh yeah, like there's some redness on the tip of the tongue, that matches up. And they're also saying that they have a cold, great. And then you can look at the palpation, right? And see if their body physically tells you the same story, because sometimes when they are on medications, or they've had 5 cups of coffee or something in the morning, right, their pulse changes a little bit, and then it can get really confusing, right? So I would then back that up with hara diagnosis and also point diagnosis as well. So I would be really specific about what you're touching, what you're feeling, and then put that into your diagnosis. This can really change what you are doing with your practice. It can back you up or it can change your mind. And on top of that, if you palpate after you're done and or take the pulse after you're done, it can then reaffirm what you've done and said, oh, well, you know, I meant to tonify the lung or disperse the lung, whatever. And let's say you meant to disperse the lung and I actually ended up tonifying it. My treatment didn't work as I thought it did. Now, what do I need to do? And this is where our number 2 thing comes into play. The second thing that you can do, which is technique. Now, using technique based on what the patient needs for that day and making sure that technique is as gentle as you possibly can is really important to be the left hand of the right in regards to your diagnosis. So whenever your patient comes in and you're like, great, I know they have lung excess, I don't know, like let's just say lung excess. Now you need to say, what techniques, acupuncture and moxibustion techniques can I do in order to truly address what my palpation is showing, where that heat is, where that jaki or shieichi pathogen is in the body to address what's happening here. Now, I said that really gently and easily, but to be quite honest, learning pulse, learning technique, learning the correct palpation, all of these things are really hard to learn when all you have is a book. Books don't guide you that well, unfortunately, in this kinds of things. And studying the classics, I think, are amazing things to do, but also it's not a hands-on physical practice. So I really recommend that you get a mentor to help you teach these things, both online, in person, someone you can consistently ask questions to. Otherwise, you end up getting really, really confused. Now, saying that, I would love to know how many of you already have a mentor in your practice and how many of you are looking for a mentor. Go ahead and let me know in the description box below. Now, the third thing that I think could really, really help your practice is Moxibustion. Now, for those of you who know me, I love Moxa. It is so amazing and it feels so good. I might be a cold deficient type. And it's just so powerful as a treatment. Learning how to truly excel at half-grain moxa and the other versions of moxa as well, and when to use and differentiate between them, can really take your practice to the next level. I highly suggest, even if you have no interest whatsoever in traditional Japanese medicine, please learn Moxibustion. Well, learn everything that I'm suggesting in this video. It's all going to be beneficial to you. But if you're really looking to transition your practice from TCM into traditional Japanese medicine and you have yet to really develop your moxa practice, I would start doing that today. Now, I have several videos on this channel that are free to you to help you start your moxa practice. So start on a tissue, start learning how to use it, because Moxa is a really effective way to treat so many things that sometimes acupuncture just doesn't do as well. Now, saying that, my teacher Yasuda Sensei would definitely disagree. He always says you can treat anything with acupuncture and anything with Moxa, and he is right. Saying that, when you're in the first 10-15 years of your practice, oftentimes it's a lot easier to disperse with your needles and to tonify with your Moxa, especially if you haven't learned how to really tonify with needles or really disperse with Moxa. And yes, you can disperse with Moxa. So I really suggest that you find a mentor, find a program that you can really dive deep into Moxibustion. It can be extremely powerful. I can't say that enough. So the fourth thing that I would absolutely love for you to add to your practice right now is Shonishin. All of these lovely tools. Oh, I love Shonishin. I love treating kids. I love bloodletting. I love Moxa. I'm just such a geek. But we don't have enough people in our field who are treating children and treating really sensitive clients like cancer clients and stuff like that. And these tools can be so beneficial for cancer patients, post-cancer patients, patients with terminally ill diseases, and of course for any child from newborn all the way up to 12. They're non-insertive techniques. They are extremely effective, and they can be a little bit daunting to learn, I'm not gonna lie. So again, this is another place where mentorship really does play a key here. I highly suggest finding someone who treats children, who understands Shonishin, and start learning these tools. Now, I have another video that I just made about the basics of Shonishin, so if you want, you can check that out. I'll link that in the description box below. But Shonishin is just so powerful, and it can be really geeky and fun too. So these are great tools, by the way, if you love treating animals, honestly. Because Shonishin is not considered acupuncture anywhere but in Japan. It's actually, a lot of times when they do acupuncture clinical trials, they'll use Shonishin as sham acupuncture. And then often those clinical trials will show up proving that acupuncture is a sham because they're like, look, the ones that didn't insert work too. And it's like, yeah, because that's also acupuncture. But I digress. In the US especially, these are not considered acupuncture. So it's a little bit of a gray area for most of us to treat animals. But if you are a vet and you're able to put your hands on animals to treat, these tools are absolutely amazing. And I tell you what, you do not need to use needles on most animals in order to get a really powerful result. So try it out. So the fifth and last thing that I would love for you to integrate into your practice to get better results and more confidence is to create treatment plans that are focused on the patient in front of you. Now, I've said this a little bit all throughout this video for pulse, palpation, all of those things. And if you listen to my channel, I talk about this quite a bit. But treating the patient that is in front of you on the table is always better than treating a book or using the points from a book, really, to treat that patient on the table. You're going to get more advanced results 100% hands down every single time. So in order to do this, you're going to have to go back, really look at that pulse, really focus on your palpation, right? In order to hone in the places that you should be treating, but it's going to 100% hands down every day give you better results in your treatment if you base your treatment on the patient in front of you rather than what a textbook tells you to do for them. Now, all of that I said really nonchalantly, and it's like, oh yeah, you should just bring Moxa in your treatment and Shonishin, but I fully realize that these are really difficult things to learn. In fact, that's the reason why I built ShinKyu University, because it is a foundational program that brings all of these aspects into your learning, helps you utilize books like the Shanghan Lun and other classics to approach the patient with pulse, palpation, technique-driven, gentle approaches, and of course Moxibustion, to really get advanced results and to understand those results, whether they're same, better, different, or worse for your client, right? You need to understand them so that next time you can be better for them. So if that's something that interests you, please do. Let's have a conversation. Let's chat about your practice, your goals for your practice, how ShinKyu University might be able to help that practice. There's a link for that discussion in the description box below. let's talk and let's see if we can help you become more confident in your practice. Now, saying that, if you do have a mentor in your area that you've been studying with one-on-one for years, you're amazing. Don't let them go. They are gold. But I would say for the most of us, we don't have mentors in our area. We have to travel really far for one-off workshops. And while those one-off workshops are amazing and inspiring, oftentimes they do lead to more confusion. So while I don't want you to stop your learning and not go to those workshops, I would really love that if you go to them, that you have a plan going forward to not just study one time or 3 times, that you have a plan to study for the next 5 years. Because really, you need 5-10 years with your mentor to really get to that next level, not 3 classes. Thank you so much for watching to the end with me and having a cup of tea. Don't forget to like, subscribe, and hit that little bell to be notified of future videos all about traditional Japanese medicine. Now, going forward, if you're interested in learning more about Shonishin and what tools to choose, check out this video right over here.